All right. So, as you move through this process, once you've made sure that the person is who that they say that they are, that they know what to expect, they have the limits of the evaluation explained to them, and they've consented to that, we're going to get a little bit of psych history. So, a couple things we're going to ask about. One is how many things of these have come up for this client in the last month. We're going to ask about suicide attempts or other self-injury. We need to know if this client is safe, and if they're going forward with this evaluation, we need to know that they're feeling safe and comfortable and oriented. If they disclose that they are feeling actively suicidal, they have significant current self-harm. If you click this box to identify that as something that's going on for them, a couple steps will pop up here. We have an ASQ if there's any suicidality within the last month. And what you would do to administer that is click on this link, which will take you to Healthy, create charting notes. Under there, you'll see a suicide screen, and you'll create that and complete that with the client before moving forward. We need to establish that all of our clients are safe at the time of the evaluation and able to safely engage with the topics at hand. We want to make sure our clients are not psychotic, having hallucinations, delusions. Please explain as needed. Sometimes they're aware of this if it's something that's happening for them, and sometimes you might see this. So if you're noticing those things, please be sure to click these boxes and add these notes. A couple things regarding medications. If clients are on new medications that have significant side effects, like someone has started Thorazine and they are very sedated, that is going to interfere with this. But if they've just started an SSRI or something that's a little bit less impactful, that should be fine. So we're prompting to understand what the new meds are and what their impacts are. Other things like new psychiatric medications are going to be things that we definitely need to be aware of. Any major medical problems, if the client has had something like open heart surgery in the last month, this is probably not best timing to go forward with this evaluation, and we could probably put this off for a couple weeks while they get more, healed up, feeling better, ready to engage when they're not worried about their physical health. Worsening of existing problems, some clients know that they have OCD or bipolar disorder, and if recently they have been really struggling with that, again, this is probably not the best time for them to be engaging in our process. And we'll just need to reevaluate a time that's better for them to come in when they're more stable. Any other significant life changes we also want to ask about? Is anything else going on for this client? Were they recently divorced? If so, how are they handling that? Does this feel like a good time to be doing this? Or did their partner just walk out on them and they have a lot of complex feelings around that? That is going to impact this evaluation. And what we would do is reschedule with them for when things are more settled and stable. This last box, you would check if nothing significant has happened for them. We also are going to ask about mental health concerns that may have happened at any time, not just in the last month. So if they disclosed that they had suicidal ideation in high school, that's something worth noting and talking about, and how long that lasted, getting information about that, doing that in these notes. Homicidal ideation, obsessions, ruminations, all of these have their definitions here. So if you're not quite sure how to explain that to a client, giving them this definition is great. Phobias, delusions, any hallucinations, trauma. If clients don't want to disclose what their trauma was, that's fine, but please try to get an understanding of when it happened so that we can best understand if this is something that's happened recently, if it's something that happened in childhood that could be still impacting them today. Getting the information we can about the way that that's impacted their life is going to be really helpful. Any substance use history or legal system involvement. If they ask, our reports are often not broad enough or not specific enough, for the court systems. We're not comprehensive enough for what the courts are looking for. That's not to say that they can't engage in this process, but they just need to be made aware that this is likely not going to be the end all be all of reports that the courts need for their services. Again, if there's nothing significant there, you can just hit that nothing significant. This is where we'll check on anything that the clients reported regarding their previous diagnoses. So, if they report they have history of ADHD or anxiety, depression. When was that? When did they get that diagnosis? How did they get that diagnosis? Is that a diagnosis they agree with? Have they had therapy for it? All of that information should go here. And checking on the medications that they're currently on. This is pulled from the fake intake that this person, this fake client, was given. So this on their intake indicated that they're not taking any meds. So making sure that that's still accurate for any of your people. And the last thing that we'll need to do in this section is decide if this person is good to continue. For most people, yes, they'll be able to continue the assessment, as you'll see here, almost everyone. And then you can go right to the next section. If they are going through a divorce, if they are currently unsafe in some way, if they need to be just delayed a little bit while things get settled for them, we'll put this, we'll check this box and do an S1, but then reschedule an S2 for when they would feel more stable and more ready to engage in the process, as that S2 is really where we get into all the clinical data we need for the report. And for the last one, this is somebody that's going to need more extensive psych services, which is quite rare. If this is the situation, please use our 911 form to request assistance and stay on with them to make sure that they're safe. This is going to be a situation that is going to me, Rachel, to Jocelyn, to the leadership team, so that we can support you should the client need it in that moment. Once you have sort of done all of these things with this client, then you'll hit the next section and you'll keep on going.